Good morning. This is Jennifer Garabedian with the Vermont Department of Health Children's Personal Care Program, and I'm here with Maryann Willson from ARIS Solutions. We're going to talk about children's personal care services, provide an overview and update, and ARIS Solutions, how to best access your services with an explanation of online timesheet reporting and some other updates about ICD-10s and overtime implications with a change in federal requirements. Oh, also, we're going to talk about online budget reports. Sorry. So I'll just start with our program overview and update. So Children's Personal Care Services is a Medicaid benefit for children diagnosed with a verifiable long-term disability or health condition that impacts age-appropriate development of activities of daily living. A verifiable long-term disability is defined as a health condition or disability that's expected to last for 1 year or more. And the federal government defines activities of daily living as dressing, bathing, grooming, toileting, eating or feeding, and mobility and transfers. This program is intended to provide supplemental assistance to the primary caregiver as individualized support for the identified recipient. So it is a one-to-one care for the child authorized services. It's administered by the Department of Health through the Children with Special Health Needs Unit on behalf of the Department of Vermont Health Access, which is also known as Vermont Medicaid. Our regulations can be found through the Vermont Medicaid Covered Services Manual through subsection 7406, which I'm sure everyone will want to go to in their spare time. What this program isn't is it's not early intervention support. It's actually not a respite program. It's not behavior intervention, specialized services, or a kind of childcare, either age appropriate or specialized childcare, although in the past it may have been used to provide many of those benefits. We have had in the past few years a sort of narrowing of how the service has been authorized and provided, which I certainly appreciate has been a substantial impact to many families. Our eligibility criteria is that we provide services to children under the age of 21 who are actively enrolled in Medicaid, again, have a medical condition, disability, or cognitive impairment, and qualify for the service based on medical necessity. Just a quick word about what medical necessity is, because that's sort of an industry term, if you will. Medical necessity is a determination that the services, that's kind of, is needed to achieve proper growth and development or will prevent the onset of worsening of the health condition. Basically, it's not diagnosis-based, so we don't authorize a specific level of services based on a child's specific condition. We do review all of the information provided to us. Each child is given a clinical review. There's no presumptive approval or denial, and there's no minimal threshold. Let's talk about how you apply for children's personal care services. There are a few requirements. You have to work with a trained assessor. You need to submit supplemental documents in addition to the application materials that we've developed, and your child must participate in the assessment in part. I'm going to speak a little bit more about that because we want to be really clear about what that means. We've worked around the state to develop a directory of trained assessors. We have over 150 people, and we continue to work to make sure that we have appropriate people and the appropriate numbers to meet the need across the state. Primarily, our trained assessors are designated agency staff, so folks at the developmental mental health organizations, and we also have staff at Children with Special Health Needs who can help families complete our assessments. If you need assistance connecting with someone, you can certainly call the Children's Personal Care Services Program, and we will happily connect you with someone who can help you complete an assessment. You need to submit supplemental documents as part of the application process. There are 3 forms that are specific to a children's personal care assessment: an intake, a functional assessment, and a care plan. Additionally, we require medical or educational materials to be submitted. And without these, an application is not considered complete, and the application review could be delayed or subject to administrative closure, which means that it will never be reviewed. It's not actually a denial and not in any way reflective of your child's need. Supplemental documents include doctor's notes, like a well child visit, a psychological evaluation, a child development clinic evaluation, a psychosocial evaluation, discharge planning documents, adaptive functioning evaluations, an IEP or 504 plan, or any number of other documents. Those are certainly only meant to be some examples of what we could accept. I'm sorry, a question just came in asking if there is an application fee for an assessment. There's no fee associated for the family. There is, Medicaid will pay for this, but there's no direct cost for the family. So the other, this was actually a change in the recent years, that the child must participate, applicant, not every person is obviously a child, but that the applicant must participate in part in this assessment. So there's certainly no expectation that the child need to sit through an entire assessment, unless, of course, this feels appropriate. For some individuals, this may actually be something that feels right for them. But the child does need to engage, well, actually that might not be appropriate either, but does need to be available to the assessor for at least part of the application. It should feel as authentic as possible for both the child and assessor. And we try to sort of leave this up to, sort of the assessor to set the parameters. Ideally, the assessor would speak with the parent or guardian in advance to sort of figure out what looks the best and will feel the best for the child, so that they're not really put on the spot or expected to sit through and hear someone talk about what their challenges might be, unless, again, they want to be part of that discussion. But it is a requirement that they participate. Then once the application is complete, all the materials are forwarded to Children's Personal Care Services centrally for review. As I said before, every child receives a clinical determination, and notification is made in writing. Families are provided appeal rights, and assuming authorization is made, it is almost exclusively a family or surrogate managed services, which means that most families use ARIS solutions. So we have a representative here, Maryann Willson, to talk about that. In instances of new authorizations, we connect the families directly with ARIS so that they can get the appropriate enrollment paperwork, and certainly all service authorization information is shared with ARIS for billing purposes. We did have one question come in, so I'm going to go ahead and answer that question, and then assuming no other questions come in, I'm going to go ahead and turn it over to Maryann so she can talk about accessing services through ARIS. So the question is, I have 2 children that qualify for personal care. Could it be possible to have one attendant for the children and pay them a little more? It's very difficult to have 2 caregivers in the home at once. So unfortunately, because the way Medicaid has designed this service, it is an individualized service and requires one caregiver for each individual attendant, and there isn't a mechanism to allow one caregiver to provide services to more than one individual through children's personal care services. So that isn't a possibility in this service. So there's a question that's come in that says, is there a program like this for adults, people over the age of 21, who don't qualify for adult services? I apologize, I'm a little confused about the specific wording of this question. So there are adult services managed through the Department of Disabilities, Aging, and Independent Living, otherwise known as DALE. So I apologize if I use that acronym. I'll try not to. And they oversee a number of services. There are services for folks who have developmental disabilities, often known as the DS waiver, and that has a very specific eligibility criteria. There is the Attendant Services Program, often known as ASP, which is probably the closest complement to Children's Personal Care Services. And then there's the Choices for Care Waiver, or CFC, which is a little bit more, has a little bit more of an intense eligibility criteria. And that is also available to folks actually over the age of 18, but usually folks stay with us until 21 and then look to age into one of the adult services once they've turned 21. And again, I would encourage anyone who has a loved one who's turning 21 to call Children's Personal Care Services or like a local agency, either their developmental mental health agency or their area aging area agency on aging, or visiting Nurses Association probably 6 months before turning 21 if they want some assistance, but certainly feel free to call Children's Personal Care and we can help you get to the right entity. It doesn't look like any other questions have come in yet, so I'm going to go ahead and turn this over to Maryann and let her speak about ARIS Solutions.
Thank you for being patient while I learn the intricacies of clicking to move these slides forward. My name is Maryann Willson, and I am the Fiscal Agent Director at ARIS Solutions. I've been with ARIS Solutions now for about 13 and a half years, and have come along the way with many families and many of the changes that have taken place. What I'd like to do right now is just give you a very brief understanding of fiscal agent services and the role of ARIS Solutions. I want to touch on the new Fair Labor Standards Act and how that applies to children's personal care services and your employees. I want to talk a little bit about how you can access budget information online so that you don't have to wait for those reports to come in the mail. I'd like to speak briefly about electronic timesheets to help you avoid the multiple challenges of mailing, faxing, or emailing timesheets. And then lastly, just briefly, very briefly, touch on an employer identification number and why we have been asking employers to obtain those for us. ARIS was formed in 1996. We were created by 2 developmental service agencies in the state of Vermont who wanted to find a way, in the face of some very significant statewide budget cuts, to make sure that they could maintain the level of services for consumers that they had been. So they decided to merge their business offices and were able to sustain a 6% statewide cut without cutting consumer services. We continue to be overseen by those 2 agencies, and our board of directors are comprised of family members and consumers who are served through those 2 particular agencies, and they are Lincoln Street Incorporated and Upper Valley Services. 1998, we expanded along with the state of Vermont to provide fiscal agent services or payroll services, essentially, for families in Vermont. Currently, we are the fiscal employer agent for the state of Vermont, and we process payroll on behalf of approximately 4,500 Vermont participants, and those include both children's personal care, participants in developmental services, choices for care, the attendant services program, flexible choices, traumatic brain injury, and a moderate needs program. Additionally, we provide fiscal agent services for Vermont VA veterans who are participating in participant-directed services. We process a very large payroll. It's $63 million annually, all of which is billed to Medicaid. And that's a little bit of why we're very particular with timesheets. Everything that we process is essentially billed to Medicaid. And in the event of an audit and Medicaid comes back, we have to assure that we've been acting in compliance with all those regulations. Our role is simply to process payroll and act as the agent on behalf of the employer. And that's the reason for filling out the initial employer paperwork. All employers are fulfilling a legal role of employer, which is not unlike any other company or business anywhere in the country. And so employers have to be in compliance with all Department of Labor, IRS rules, and so on, in addition to making sure that Medicaid is in compliance. Our role is to help you with that. We issue payroll, we pay payroll taxes on your behalf, we bill Medicaid for each child's services, which is why we have to make sure there's a valid Medicaid eligibility in place. We issue all of your employees' W-2s at the end of the year. We process Department of Labor information, including processing claims for unemployment when employees are no longer working. And just be clear that you do know that if your employee is terminated from employment for one reason or another, they can always apply for Vermont unemployment. That is a benefit that's available to them. Additionally, I didn't note here, all employees who are paid through ARIS Solutions are covered under workers' compensation, which is a state policy. And in the event of a work-related injury, employers should contact the workers' comp company. The phone number I can share with you all later, but is also in our handbook. We also provide technical assistance by phone and through our website for employers. ARIS is paid by Medicaid and through state of Vermont programs. At this time for children's personal care, we bill Medicaid on a monthly basis, and we bill a monthly fee. It's called a per member per month fee. So we bill that separately from the services that are provided. It's not included in any of the employer taxes that you see if you're working with a dollar-based budget. And it does not come out of the child's budget. There's a very major change that has just taken place, and while in some regards it has been a long time coming, it was something that was put in place very quickly within the last month, and that is a new rule regarding overtime payments for employees who provide home care services. And this new rule narrows what used to be known as the definition for domestic employment and companionship services. And the new rule from the federal government says that any employee who is providing 20% or more of their work hours in the assistance with activities of daily living with the individual they provide care for. If someone works more than 40 hours in a week and provides more than 20% of that time providing assistance with activities of daily living, that individual must be paid overtime for the hours over 40 hours a week. And overtime is essentially time and a half pay. We are required to automatically pay all employees overtime for each hour worked over 40 hours in a work week. And the work week starts on Sunday and ends on Saturday. It is our understanding that the nature of children's personal care services, which focuses on essentially on ADLs, places employees in the position of being required to be paid overtime for the services if they work more than 40 hours a week. When an employee works for 2 children at the same time, if it's the same employer, we don't count those hours twice. We count the hours once. So it's just as if a child was being served by a staff person at an agency. The agency wouldn't pay the employee twice for providing services at the same time to 2 children. We'll pay the employee once at the two different pay rates for both children, but we won't pay the overtime. The overtime won't count on those combined hours. If is an employee who works for an employer who has both children's personal care and perhaps has another individual who is served through developmental services or any other program, the hours for both individuals count toward overtime.
The question is, do you pay overtime for more than 8 hours in a given day?
No, the overtime is based upon a 40-hour work week. So the question that we have is, do you pay overtime for more than 8 hours in a given day? No, we pay overtime based on a 40-hour work week. And the work week, again, starts on Sunday and ends on Saturday. For those of you who work with the dollar-based budget and you may have variable rates that you're paying your employee in a pay week, we average the rate of pay over the course of the week, and overtime is based on that averaged rate. If you have questions about how we determined a particular overtime rate or how we determined overtimes based on a particular timesheet, please don't hesitate to call. The biggest impact of this program, in addition to issuing payments to employees for overtime work, is on the budgets for the children. When a child has a dollar-based budget, employers are monitoring their budgets very, very carefully. There are increased costs, obviously, related to overtime, and employers are going to need to watch their budget very carefully. The same employer taxes apply, so every time we pay your employee based on the gross or the total wages they earn in a work week, we also have to add another 12.4%, which covers the employer's matching Social Security, Medicare, unemployment, and workers' compensation costs. We are only able to pay out up to the budget that's available for the child. So in the event that the overtime results in the depletion of the budget, we can pay only up until the available funds available. Does anyone have any questions regarding overtime before I move on? It is a fairly significant change and did go into effect on October 13th for the work week beginning October 11th. Okay, no other questions on that. One really nice feature that we've been able to offer for a few years, and we'd like to see families access this, and I think very often families just don't know about it. Your budget reports are available online, and if you're able to access our website at www.arissolutions.org, employers can go ahead and click on services, children's personal care services, and then click here for your budget and enter information for login, and you'll be able to pull up your individual biweekly budget report. This is the same report that you receive in the mail. However, it is updated every payroll week following our issuing of payroll on a Thursday afternoon. Occasionally there might be a glitch if you're finding that you're accessing the online budgets and they just don't look updated. Give us a call. Sometimes the updating process is not smooth. But by and large, employers are finding this to be a really easy manner of accessing budgets, knowing what funds are remaining available without having to wait for your mail to come in, which often comes in almost a week after you've started the new pay week. So if you have questions, don't hesitate to call us.
There's a question of how many folks access, how many people use ARIS for children's personal care?
The question is how many children or families use ARIS for personal care services. For children's personal care services, I believe the number is currently about 1,400 children in the state of Vermont. So out of the 4,500 individuals that we mentioned earlier, approximately 1,400 children are accessing children's personal care payments for employees through ARIS Solutions. What you're looking at now is the homepage of our website. To access any services and certainly to access children's your budget reports, you would go to services, you would click there, and that would bring you to a menu where you would click on children's personal care services, and then you'll scroll down, click here for your budget report, and that will bring you to the login page. I do want to point out that we make available much of the paperwork that's necessary for hiring new employees, for adding direct deposit if they've chosen to do that after their hiring, W-4 forms if your employees wish to change their withholding status, timesheets, background check policy information, and general information about how to manage a dollar-based program. So please feel free to access the online system. It does provide you with some valuable information. We also put important alerts on here as issues come up and programs and policies change. This is the login page. Your company ID is located on your current paper report. It's on the right-hand side, upper right-hand side of your report. If you don't have a report available and you want to check your online budget, just give us a call and we will give you your company ID. Your PIN is the last 4 digits of your Social Security number. Now I want to get to an issue that is particularly frustrating, I think for everybody, and that's getting timesheets to ARIS Solutions. Timesheets have to be in our office on Mondays, and that can be a pretty tight time frame. Once upon a time, all of our timesheets came to us either by U.S. mail or by families dropping them off at our office in White River Junction. In the past 3 or 4 years, we've made available to a couple of other options. That is faxing timesheets and emailing timesheets to us, which need to be in our office by noon on Mondays. There are multiple problems with emailed and faxed timesheets, and while I think that it's a wonderful opportunity and option for families to fax timesheets and email them, there are problems that those timesheets don't go through. Sometimes fax timesheets come through blanked on our end, and we don't know who's faxed them to us, so we don't know whether or not the timesheets come to us. There are times when an employer inadvertently enters the wrong fax number. Email timesheets don't always print out automatically if they're not in a PDF format. So again, these are great options, and while they work probably 98% of the time, there's a 3% of the time when those timesheets don't come through, and we are concerned that we aren't able to process payroll when we don't get those timesheets. And in general, we don't know that we didn't get the timesheets, so that can be difficult. Driving to White River Junction for most families in Vermont is just not a reasonable option, although we do maintain a drop box at our office, and people can drop off timesheets during regular business hours. In order to address this, we have put together a new option. It's actually been in place for a couple of years now, and that's online electronic timesheets. If employers are to go to our website, on the top of the homepage, you'll see electronic timesheets on that menu page. And once an employer and employee are registered, an employee can go at any time onto the electronic timesheet site or portal, and they can enter the services that they've provided. They don't need to worry about faxing, emailing, going to you going to them to get the signature, coordinating all of that. The timesheets can be done by the employee who completes the timesheet, and timesheet remains on the website securely, indefinitely. No more need for copies because an employee and an employer can look at any time the employee's timesheet. The process essentially is the employee fills out their timesheet online. Once they've completed their biweekly timesheet, they authorize it. Upon authorization, an email goes out to the employer, and it tells the employer that the timesheet is ready for the employer's review. The employer logs in, looks at the timesheet. If the timesheet is accurate, then the employer simply clicks approve and submits the timesheet, which signals us that the timesheet is now available. One of the really nice factors of this is that if you have trouble or your employee has trouble at any point during the way, and this is particularly true when people are just getting started, you can call us and we can shadow you through the process. We can see where you are, and we can help you and do any of the problem solving for entry. We also are able to see at what time the employer logs in and the employee logs in and are submitting the timesheets. Once the employer has submitted the submit button, that means the timesheet signals to us that it's ready to be processed. If there is a problem with the timesheet, the employer would click on reject, and that timesheet, and enter a note. There's a little box, and the employer will enter a note saying why the timesheet is rejected. It may be that the employee didn't put in the right pay rate, or the employee put in the wrong dates of service or wrong hours. When the employer clicks reject and writes in the note, that will trigger an email to the employee saying your timesheet has been rejected. You need to correct your timesheet. The employee will go in and correct it, send it back to the employer, and then the employer can authorize it. We process all electronic timesheets on noon on Mondays. That means we pull all of those timesheets that have been approved by employers on noon on Monday, and then we begin the process of putting them in our payroll system for payment that Friday. The one thing that the electronic timesheet process cannot do is for those people who are using the C3 program, it cannot process mileage or other non-wage expenses. So the online timesheet portal is for employee wages only. And lastly, over the past year and a half or so, we have sent a number of letters out to employers asking them to complete some new paperwork for an employer identification number. There have been changes with the IRS regulations. At one time, the state of Vermont, under contract with ARIS, made a determination that obtaining a federal employer identification number was not necessary. Recent federal IRS regulations have overruled the state of Vermont's position on employer identification numbers. So we are now in the final process of obtaining employer identification numbers for every employer. Many, many, many employers have sent in this paperwork to us, and we've obtained their employer identification number. We still have about 500 employers for whom we are still waiting the paperwork to obtain their employer identification number. If you have received any of this paperwork and haven't sent it in, we really urge you to send it in as quickly as possible. If we do not have the paperwork back in our offices by December 31st, we will not be able to continue processing payroll until that employer identification number is obtained. This is a federal identification number, and every employer who acts legally in the country has to obtain this employer identification number. There is a special designation for what's known as household care service recipients. It's HHCSR, and that EIN designation is solely for the purpose of home care providers and employers, so that it's when the information is forwarded to the IRS at the end of the year, all the tax information, it doesn't get commingled with your personal family financial information to the IRS. This designation also helps the IRS understand that all the wages that are being paid to the employees are not your own personal funds, that these are all Medicaid-funded services. They also understand that you as employers don't have access to these funds yourselves. So it maintains a separate status and doesn't involve your own personal taxes. Questions? I'm wondering if anyone has any questions about the recent change over from the diagnosis codes for ICD-9s to ICD-10s. This is a federal requirement, and as of October 1st of this year, Medicaid payments and all medical healthcare payments and services are based on a new diagnosis code process. And that has affected the payroll for some employees. The Children's Personal Care Office has sent out a number of letters to families asking them to obtain information from their doctors. And then Children's Personal Care has provided that for ARIS Solutions. And for those children for whom there are still no ICD-10 codes, the new diagnosis code as of October 1st, we've been unable to process payroll.
An unrelated question is, what if a parent has a disability and can't figure it all out? That seems very complicated.
It does seem very complicated, and I'd like to tell you that it's as simple as can be. There are some significant requirements when someone opts to become an employer.
They didn't hear the question. I answered you, but they didn't hear the question.
Jennifer and I are trying to work together on this, so I appreciate you bearing with us. I didn't read the question. So the question is, what if a parent has a disability and can't figure all of this out? It seems very complicated. So again, it is complicated. And while ARIS Solutions staff are available to try to assist families in walking through this, we are available by phone, and that can be difficult. We do have materials available, but if an individual has a difficult time accessing those materials or reading them, it can also be a challenge. Children's Personal Care Service staff are available to help. If you're affiliated with an agency, we encourage families to work together with an agency. We try to make the process as simple as we possibly can, but because these our payroll processes and the services that are provided are both Medicaid funded, and payments are made through the federal government in terms of reporting wages and so on, and employers have to maintain Department of Labor compliance, it is complicated.
So you have this family question, how do you get the
We obtain the EIN for you.
So again, they didn't hear the question.
Oh.
So if
How to get an EIN. I'll get this before the end of the webinar is over, I promise. The question is, how do you get an EIN? We have the paperwork necessary to obtain an EIN, and we have tried to send that out to families. If you do not currently have the paperwork, please give our office a call at 1-800-798-1658, and we'll send out the paperwork to you. The paperwork will be color highlighted for the employer, and the employer should fill out only those highlighted sections of the paperwork. If you'll send that paperwork back into us, we will obtain the EIN for you. It's necessary for us to do that so that we can make sure that you get the special health care, home health care service recipient designation.
Mary, you might want to also explain that you are requesting from the families who need it versus having families just call.
Yeah. Yes. For those of you who have already filled out the paperwork and send it in to us, there isn't a need to contact us to obtain the paperwork. For those of you who don't know if you've sent in that paperwork to us, give us a call and we can tell you. And for those families who don't think that you have filled it out at all, just give us a call. And again, we'll send out the paperwork to you. There'll be 3 forms that you need to fill out. One is the application for employer identification number. The second is an employer appointment of agent, and that form is the form that allows us to process the EIN paperwork and your payroll for you. And the third form is a tax information authorization form. Again, it relates to us reporting the wages to the IRS and Social Security on behalf of your employees. All 3 of those are necessary and work together with the application for employer identification number.
So there's a question that if 1,400 families use ARIS, what do the other families use?
That would be a question for Jennifer Garabedian. Okay. And hold on for a second, and she'll read the question for you.
Hi, good morning again. So that question came in asking if 1,400 families use ARIS, what do the other families use? I think previously Maryann answered that there is approximately 1,400 families who access Children's Personal Care Services and use ARIS for their payroll services. We do have about 1,400 families actively, or 1,400 children actively enrolled in Children's Personal Care Services. About 99 point something percent of them are family or surrogate directed. So again, they use ARIS solutions for their payroll services. A very small percentage of them have an agency directed service. So they go through a Medicaid provider. It's a very important service, but again, a very, very small percentage where services are actually managed and provided by a Medicaid provider. It is an option that's available, but unfortunately, we just don't have a lot of Medicaid providers who are in a position to provide the service. That question just came in that said, are there certain areas in the state where there are fewer families who use PCAs? Do you do outreach to perhaps rural areas where families may not take advantage to seek out public programs? That's a great question. We are just beginning to be in a position to do a lot of data analysis, and I do apologize that that's not something that's been a part of our program previously. We are certainly in a better position with staffing recently. And so I guess I'm not sure if I can answer this question really articulately. We've done different outreach across the state, but have not focused specifically on rural areas. But this is certainly some feedback that I can take back. And as we continue to develop our program, work with, we do a lot of collaboration with community providers. And this could possibly be something that we do more of in the future. Okay. Another question just came in. Where can family get help finding a PCA, recruiting PCAs, and doing background checks? Seems so overwhelming to many families. Again, I think this does speak to the fact that managing this service can sometimes be very challenging. There is a online registry that can help some families. It's www.rewardingwork, as all one word, .org, which is where some families have had success. These employees have not been vetted through anyone, but they are people who may be interested in providing services. Depending on the region in which a family is looking to find a PCA, there may also be other local places like colleges or hospitals where finding an employee might provide some, some possibilities. All background checks are run when a potential employee enrolls at ARIS. So the background check piece hopefully is not too daunting because that's done through the paperwork to enroll as an employee. Certainly, if a family is looking for some ideas on where to recruit a PCA, they could call Children's Personal Care Services, and we would happily try to help steer a family to where some possibilities could be. A question just came in. Can a family member who lives in the home be a PCA? Absolutely. There are some restrictions on who could be a PCA. It cannot be a parent or someone who's considered to be the primary caregiver. It's a little bit more detailed than that, and it's listed in our regulations. Maryann is just letting me know that sorry, I'm struggling to read her handwriting a little bit, that there is an exemption from the overtime requirement for, thank you, an employee who lives in the home. So there are some benefits if you can find a family member who lives in the home to provide personal care. But absolutely, if you have specific questions about who you're looking to employ and whether they might be considered a primary caregiver, again, I would encourage you to call Children's Personal Care Services. I do apologize because there are two of us. Sometimes it can be a little challenging to get through to a warm body, but we do our best to take all the calls and return all our voicemails. I'm not sure if I've given you our phone number. It's, I'll give you my I don't even know if I know our toll-free number off the top of our head. You can reach me at 802-865-1395. And again, if you don't get me directly, please press 0 and ask to speak with someone directly. Just looking to see if there's other questions that have popped up. Okay. I think someone just asked if we could share the contact information. So again, I apologize. Our toll-free number, I'm totally blanking on what our toll-free number is. So I can share the ARIS toll-free number again, which is 1-800-798-1658. And I'll give you my direct phone number, which is 1-802-863, no, 865. 865, wow, 865-1395. And again, if you don't get me directly, please press 0 and ask to speak with someone. Thank you. I don't know. Okay. So as we're not seeing any other questions, we're going to go ahead and end our webinar. So thank you for joining us for today's webinar. This webinar will be archived on Vermont Family Network's website, along with many other previously recorded webinars. Be sure to visit VFN's website at www.vermontfamilynetwork.org for a complete listing of upcoming webinars, workshops, and support groups. For support and information, call VFN at 1-800-800-4005. Thank you and have a good day.